Hi, my name is HAASHWEIN and my matrix number is D2020209681. So today I'll be talking about the first question, which is skull fracture in a sport of rugby. So what is a skull fracture? A skull fracture is a bone in the skull where it has been fractured or broken by impact. Now take note that a skull fracture isn't easily happenable. It takes a lot of force to crack bone in the skull. So based on the assessment, this seems like a depressed fracture when the skull has been pushed in due to the impact. The second part, what are the signs or symptoms of a skull fracture? So easily is noticeable there will be a lump or dent in the head itself, or there's some slight bruising or swelling on the head. Usually the athlete itself, they will face some confusion or headache. On severe cases, they might even lose consciousness, and there might be even clear fluids oozing up from their clear fluids like blood or anything else oozing up from their nose or ears itself. So what will happen if it's not diagnosed properly? So if an athlete does not receive proper care or attention, it might cause long-term disability or impairment. On severe cases, it might even result in death. Now please do note that sport injury related deaths are not common, but the leading cause of death in sport-based injury is due to related mostly on brain traumas and skull fractures or brain-based injuries itself. So based on the toe tap methods, it is easily diagnosable for the skull fracture or the injury itself related to brains. So the toe taps method consists of talk, observe, touch, active movement, passive movement, skill test. It is one of the effective ways to assess the nature and the extent of an injury to the player and make a decision whether or not the athlete is fit to return to the sport to resume playing. Now, the athlete must pass all the assessment procedures in order to be considered fit enough to return to the playing field. If the athlete is unable to complete one of the assessment tests, then the athlete is considered as not fit to return to the playing field itself. Alright, so right now I'll demonstrate the ways to stop bleeding and bandage the sport-related skull fracture. So these are the ways to bandage an open skull fracture. So first of all, we go to the patient, place the bandage cloth appropriately towards their forehead, ensure they're not covering the ears, cross it through, make sure it's not too tight, bring up to the front, cross the tie on left to right and right to left. Ensure it's neatly and firmly tied up. Any balance of the cloth should be tightened inwards. Ensure there are no more cloths protruding outwards. This is how it will look. Alright. Okay. So what are the further observations after giving treatment? Sir, is the bandage feeling too tight or is it just nice?
Just nice.
So are you feeling any headache or nausea, or do you feel that you're losing unconsciousness? Is everything okay? So if it's not, we can bring you for further treatment.
Before performing CPR, it is important to assess the patient according to the RABC principles. The first part of the principle would be to identify danger to ourselves and the person lying around us.
Okay, sir?
The second
Sir,
part would be
are you
to
okay?
initiate a response from the patient through gentle tap or communication. The third part would be to ensure that the airway of the person is clear. The fourth part would be to ensure if the patient is breathing or not.
Hello, 911.
The fifth part would be to ensure if the person has a circulation or a pulse or not.
Of Oopsie. Alright, sure. Okay. So one of the first steps of performing CPR is to ensure that the patient is sleeping right on his back and the airways are not compressed, and ensure that his neck is slightly tilted so the airway is not disrupted. So place both of your hands at the sternum where the heart is located. Perform compression quickly at a rate of 100 compression per minute. So once you reach 30 compressions per minute, pinch the nose, open the mouth and blow in. Blow in twice and then repeat the compression again 30 times. Keep repeating for cycles until there is slight pulse or breathing is resumed back again, or even until help arrives. So these are the steps of performing CPR. Once the patient has regained consciousness, it is important to place the person on a recovery position. If there is any breathing or pulse in the patient, if there is, then place the victim on the recovery position as following. This is the recovery position for a person once performing CPR on them.